Test, test. Test, test. Testing one, two, three. 5, 4, 3, 2, 1. Test 1 2 3. Test 3 2 1.
Finance Committee will please come to order. Welcome, everyone. Good morning. Item number 2 is citizens wishing to address the committee. Any citizens signed in? None. I believe none. All right. Approval of the minutes from the May 27th Finance Committee. I'll entertain a motion on that.
Move to approve.
Motion by Mr. Zimmerman, second by Mr. Bose. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Item 4, we have a special guest with us this morning, Criminal District Attorney Sharon Wilson. You are going to make a presentation for us this morning, I believe.
Yes, sir.
Come on up.
Oh, okay, and I'm going right over here, right?
Actually, you can have a seat right there.
Yes. How y'all doing?
All right.
We are great. We're happy you're here.
It's great to be here. Okay, so this works, right? Yay, it's all green. There we go. Here I am. I'm at the Finance Committee today. It's June the 24th. So happy to be here at the #1 hospital in the nation. We are very proud to be providing legal services to the #1 hospital in the nation. The last time I got to talk with you all was August of last year. And typically I try to come, a few months before the end of our contract and just discuss what we've been doing and visit with you all. So here we go. Interrupt me at any time you remember I talk too fast, so. Okay, our contract right now is a 1-year term contract, and it provides for 3 prosecutors, 1 staff person, and the total amount for you all was $677,803. So we do these specified items and these items only. We do Tarrant County Jail-related medical claims, Tarrant County Jail-related medical lawsuits in federal and state court, collection services and lien enforcement, medical malpractice claims and suits, general liability suits including premises liability, and drafting and review of contracts in excess of up to and including $500,000. Except for those specified things that deal with like doctors and that kind of thing. Those are specialized contracts. So each of these A, B, C, D, and E, I'm going to go over with you briefly just so you have some idea what we do under the contract. Okay, this is how much we cost. So we kind of picked an arbitrary number of 2018. When I pulled my presentation from when I visited with you last time, and we started at 2015. That's because that's when I became the DA, and Leslie was like, they don't care. So we picked the last 4 years. Oh, and you all know Leslie Hunt, who's the chief of our civil division.
Someone just said that your mic is not on.
Well,
I don't
no,
know if that
moved
means
it over there.
I don't know if that means it's not coming through on the feed.
Now it's on.
You should have a button at the bottom, and there's a little circle. If it's red,
It's green. It just wasn't close. I moved it over when I got here. Okay. Okay. How about that? Okay. So this is all the slides that I'm going to provide for you, and the data that I'm going to give you is for 2018 to now, and it was kind of an arbitrary choice of a year. So we have increased in the amount of money that we cost you, but also in the services that we provide. So you can see we've gone from 2 prosecutors, ACDAs, assistant criminal district attorneys. Can you hear that, or is that just me? Okay. 2 ACDAs and 1 staff person. So we now do 3 assistant criminal district attorneys, and that is primarily because of the increase in contracts. We'll talk a little bit more about that. So this is how much it costs you per person. So our attorney 6 is the one who does all the litigation, and he's at a higher rate than our 2 attorneys, and this is their actual cost. It's not, there's no padding added. This is the actual cost. And it assumes 2,000 hours of work per person, which is 40-hour work weeks, and 50 weeks a year. In the past, we knew Adams, Lynch, and Lofton also did work for you, and I think their rate was $225. We have no idea what Catton's rate is. We're not privy to that, but I'm guessing that we do it cheaper, better. Yeah, that's what we always say, cheaper, better, faster. So this is, just so you'll know exactly what you're paying for our representation. Collections is one of the things that we do, and you will see that the collection amount, we've been loving getting $4 million a year in, but the collection amount is lower in the last 2 years. And that's because, partly in 2020 because of the pandemic. You know, when the courts stopped setting cases for trial, they didn't plead criminal cases, they didn't settle civil cases. There wasn't any reason to. And so that is some decrease, but probably the better reason is the change in JPS billing practices, which I think gets you all more money on the front end and certainly saves some work on our end. So there are fewer collection matters that actually get referred to us as opposed to the past, because now JPS bills Medicare rather than filing hospital liens on third-party liability cases. So y'all get paid up front from Medicare rather than waiting for this lien enforcement. So that's a good thing. So I don't know what your overall amount is. I'm guessing it's probably more because you bill at the front end, but it has affected the amount that we collect. And that's why. Okay, contracts. So I wanted to give you some data on the contracts. These numbers, like FY 2021, we stopped counting May 31 of 2021. May 31 of 2021. And I just turned it a little so it wouldn't be so. So this is the contracts assigned, and you can see we have a steady increase in contracts. And you all will recall that there was a time, and I want to say 2 or 3 years ago, maybe 4, when we increased the dollar amount of contracts that we reviewed. It used to be lower, and now it's all the way up to $500,000. So contracts assigned, contracts finalized, you see the increase. We also keep data on how long it takes from the time that the day of finalization, from the time that the contract is presented until it is finalized. And only 5, so I will tell you that the average 34 days, only 5 of those days are spent in actual CDA review, because we'll review it. There'll be some red line returns. We make sure that everything is correct. So the rest of the time involved in the finalization is time for the vendor to review, the contract owner responding to questions and business issues. So we're proud of that 5-day turnaround for our part of the work. So you need to know at this point last year, May 31 of last year, we had received 350 contracts. We've received 428 on May 31. That is a huge increase. And we're coming up on our busiest contract season. So we're on track to be at 770 total contracts this year, which is a significant increase over previous years. Each year we've reviewed an average of, this year we've reviewed an average of 10 additional contracts each month. So our overall contract numbers have been higher than usual since late 2019. And it really doesn't feel like a blip or a short-term increase. It is just a steady increase in the work. And that increase actually predates COVID. So there's no, you know, in our business, we're looking at 2020 like it didn't happen because it's such a mess. But we also, it seems like we've received a lot more contracts with a very quick turnaround expectation. That's fine. That's one of the things that we do. And last year, FY19, we got about 14% of our contracts with expedited, and this year it's been about 25%. I'm telling you that because I think it's really good that we've got 2 attorneys now. You know, in the past we only had 1 attorney doing contracts, 1 doing lawsuits, and now we've got 1 doing lawsuits and 2 doing contracts, so it's actually been a good increase. Oh, thank you. Do y'all have any questions so far? I know, right? I was like, I can't, what is going on that is going off? Okay. So the claims and lawsuits. We do the litigation subpoenas, the claims, the actual lawsuits, and this is since 2018, just some data. The claims, when we get those, we review them and advise JPS on the liability, and we also correspond with opposing counsel as needed. Litigation subpoenas, we file motions to quash and motions for protective order in response to these subpoenas. We attend hearings on those motions as needed, and we also work closely with the custodian of records for the various departments at JPS in gathering and reviewing the necessary documents. So more details on lawsuits is the next page. And it looks like we've removed, we had, on the slide that I sent, which has been altered, we had the actual names of the people, because it's litigation, right? So it's a public document. But the first one was a premises liability, and the judge granted our plea to the jurisdiction, dismissed the case. Then we've had several of those. That's a great way to resolve a case as a lawyer, is to file a plea to the jurisdiction. The only one that we've had to actually settle is the last one, and that case settled for $7,500, and the plaintiff had originally made a $240,000 demand. So I am surprised that the slide was altered.
Sharon, that was me. I'd asked them to do that when we got it reviewed, just uncomfortable having names, you know.
No,
And I know it's
they're-
probably a legal public document, but
Yeah, they are. I mean, we're very careful about that too, and I had the names on there because it's a public filed case.
yeah. We just,
Anybody can look at it, right? So I get it, we're very careful about public documents. And I get it that we're at a hospital and y'all have additional concerns, but it's a filed lawsuit.
Sure.
Okay.
We always fall on that side, though. I think it's just our nature when you live by HIPAA every day. I think that we always fall on that side.
What is
We've got
premise-
two
what is
lawsuits with pending motions to dismiss. Yes, ma'am.
Premises liability, can you explain, what does that mean?
So premises liability is like a slip and fall at the hospital, right? Would that be fair to say? Yes. Leslie, why aren't you up here so that you can nudge me when I say the wrong thing? Typically, she's a lot closer so I can see her face when she's going, what?
It's an injury that an alleged injury that occurs on your premises due to what they are claiming is the fault of the premise owner. So wetness that should have been cleaned up, carpet that they tripped over, and so they're claiming that it was your fault that they were injured on your premises.
What else? Okay. So this is our team. Joy Fabella, who is a civil litigator, he's doing a great job. Courtney Taylor is our transactional attorney. We've added in the last year James Nichols, who is also a transactional attorney, and they just do an amazing number of contracts. I'm very proud of them. And Julie Creamer, who's been here at this operation at the JPS as the legal assistant for a long time. So we wanted you to know who our attorneys are. We're happy to be here, happy to be working with you all. And here I'm back to the contract. So what we're going to be looking at is the next contract, and I will tell you that according to the terms of this one, we are planning to provide you our proposed contract to you, to the board, Robert Early and Daphne Walker, as probably by the end of the month, like in the next week. And that way you can do it in your budget. It would also help us to know what your plans are, because we're going through county budget also. So previously, we've had 2-year contracts. Our contracts have been 2014 to 16, 18 to 20, 16 to 18. It's been 2-year contracts. The contract, this one, was a 1-year contract, and it was done that way primarily because of the changes in how you all do your legal services and how you've decided to do that. So this contract, as all of them, contains a provision, which is 8B, that allows either party to end the contract with 90 days written notice, and that's without regard to how many years the contract's for. And based on the quality of our work, and I think what is the low cost to the public and to you all for our services, we would request a 2-year contract because it would make it easier for us to do our budgeting and planning. We'll get that contract to you, our proposed contract to you, unless I hear from you that you don't want a 2-year contract. Whatever you tell me. I'm fine with that. Or if you tell me that y'all are done with us, I'm fine with that. I just would need to know, it would be better for me to know at this time, because we're in budget at the county, and I want to make sure that I've got places for my people. So, on July 8th, I'm on vacation, so at the Board of Managers meeting, Leslie Hunt will be there if there's.
I don't think that paperwork came across my desk for your vacation.
I
Is that
know,
on its
right?
way, I guess?
You can call my husband, tell him I'm not going. So we're out of here. You know, I guess that my only request is that as quickly as possible, or as soon as possible, y'all can let us know what you're gonna want. And we can work on that. But we would like to have it resolved, hopefully by the next Board of Managers meeting, if possible, because that gives us another month to deal with the commissioners and budget.
Sure.
And I think
ahead.
Sharon mentioned this, or pointed this out, that the 90-day written notice, it allows an exit ramp with 90 days notice, whether it's 1 year, 2 years, or 3 years. So in a lawyer world, it's really not a 2-year contract or a 3-year contract, it's just a contract with a
Right.
90-day out, so.
Got it. Well, and I'll speak for myself, but I think I probably speak for the majority of this board that we greatly value this relationship that we have with y'all's office and your team and the work that you do. I will say, you know, from our side, you know, I'm gonna rely on the guidance from Daphne in terms of the structure of the contract and all of that, but I'm certainly supportive of the services y'all provide, and so once she tells me what it looks like, I think this board will probably be very supportive. So, any questions of Ms. Wilson? Well, that was easy.
Yeah.
Well, we just wanted you to know what we're doing, and I guess that we'll hear from someone
I would
about
say
what the.
interface
Daphne
with
will let
Daphne and
us
her
know.
team.
That'd be great.
And she'll guide us.
And I don't know what y'all's schedule looks like, but we are trying to get our proposal to you by the end of this month.
Okay, great.
It's about a week away.
Wonderful.
Because I am not going on vacation on July 8th. I'll be in Austin.
Oh, that's a vacation.
Not
so
really.
much. Thank y'all
Well,
so much.
thank you so much
letting
for
us
being here.
visit
We
with
really
you. It's good to
appreciate it.
Thank
see you.
y'all.
Thank you.
Bye, Leslie.
Thank you both.
Bye-bye.
Thank you all. Have a great day. All right, we'll move to item 5, which is CFO report. Ms. Clark. Good morning.
Good morning, how are you?
We are good.
Good. I just wanted to give you guys a heads up about upcoming budgets. July is a busy month for us. We have 2 afternoons already blocked off on your calendar for our budget retreats. Last year, if you remember, the first Friday, and these are going to be on July 16th and 23rd in the afternoon. So 2 Friday afternoons. The first one, we're thinking about, similar to last year, kind of going over some strategy. You may hear from some of the operational vice presidents about what they would like to see done, and how that supports our new strategic plan. The second day is a little bit more nuts and bolts as the 22 budget. Last year we talked to you about property taxes, supplemental funding, new programs that were coming up and how those would actually impact the financials. So kind of along those same lines.
So if you recall, last year we did this. We had those 2 half-day workshops. I thought were very helpful. I hope everyone else did. And if you have any thoughts about how you might want to, you know, tweak it or kind of set our agenda, please let either me or Sharon or Robert know so we can make sure everyone's got a, because I think for me, it helped me walk into the new budget with a lot better understanding of what was going on.
Now, those are days for discussion. So August 12th, we have set aside the majority of that board meeting for the actual formal presentation of the budget as we have in years past. So important dates.
With those dates, You have really three opportunities. You have a preliminary opportunity for listening to staff as to why they came up with some of the conclusions they came up with, more detail, and then obviously the ultimate vote. So y'all have three passes at that, and Sharon, as she has been in the past, is available for, office time and phone calls that y'all might have, because you may not see something and go, I don't know, I didn't see that last year budget or anything else like that. So we'll go from there. But the goal is to give y'all as much information as possible.
So, just one small question. The first day is where we will talk about the strategic plan. Okay.
We'll do what we did last year. We'll probably model it last year the way we did it, which seemed to be fairly conducive to what y'all's needs were, is to have some of the vice presidents come up with major budget issues and have them talk directly to you as to why we're doing this in the pharmacy or why we're suggesting we have this change, and you'll have the actual folks. And then we'll probably have a little bit at that meeting relating back to the strategic plan, and you can see the guide over that, the overlay, and we'll do a lot of that at the second meeting as well.
Okay. The reason I asked is because I'm hoping to hear that we have designed this expenditure in the budget because we're seeking to address this
Yes, sir, in the strategic plan.
plan.
Yes, sir.
Yeah, thank you for that clarification. It will be budget initiatives that have been requested to support outcomes
Yeah.
for the strategic plan that you guys have already approved.
Yes, sir.
And then the second day is a little bit more into the weeds, nuts and bolts, as you said.
Yes, it'll be a lot more of me talking on day 2 to prepare you. I mean, we had some great conversations last year. We went over volumes. We had some changes to the capital plan based on some comments that you had, and so it was more in a format that you guys were ready to approve it in August.
What might be helpful also, as we're looking at things, is the 2021 variance by department, and what they're looking at for future planning also. So what changed? And that'll help with those additional capital. I think that'll be easier for us to look at.
As it relates to capital, or is it just the operating budget?
Operation.
Yeah,
Operation.
we can look at it by division, like nursing or community health. Okay.
Amanda, are you saying like, here's what we spent last year and here's what we're spending, proposing?
The budget to actual variance.
Oh, okay, okay.
And really, from my presentation format, we do really focus on increases and decreases in spend from projected to the new budget. So hopefully it'll ferret it out.
I just have one suggestion, is that we make sure that we've got the planning folks, we got strategic planning, all of it roll up together, and so that it all kind of meshes. Sometimes we pull this apart and it doesn't click. I've asked them to get me a hard copy of the strategic plan, because looking at it online is just not helpful for me when I'm trying to go back and see where we are and where we're going. So that would help.
And I think Dorothy raises a really good point. I think you and I talked about the other day that we want to leave, pardon me, the opportunity for us to revisit some of these budget things as planning is rolling out, and some of our bond program and things like that might impact the budget. We can't predict now,
Right.
maybe the timing of them, and so we might have to plan for, mid-year corrections or, first quarter
Contingencies.
adjustments.
Yeah. We are working through a lot of numbers, especially as it comes through facilities in the bond planning program. Yeah.
Okay. Great. Is that your report?
Yes, it is. Thank you.
I've got one question.
Yes,
Will we
sir.
have this before we go to the retreats?
Would help.
The briefing, the charts and everything?
The mail out,
Yeah.
yes.
No, not just this morning. And I think To tie into what Dorothy was saying, I think I would like to have that as a notebook rather than on a computer so that we
Be
can.
able to walk in,
Yeah,
you have
we
time
can
to
make notes
kinda-
and be able to do that.
Leanne heard you, and she is ready. She's buying notebooks right now. She is set.
All right. You want to move to item 6, item A?
Yes.
Thank you, Sharon.
I'm out of practice, moving my own slide deck here. It's good to be back. So I will tell you that this month is not a whole lot different than the last few months that we've had. Inpatient volumes are a little bit lower, although you can see in the top left graph that those have begun to recover. Our CMI for the last few months at the bottom left have begun to normalize a bit as we open up a lot of our other services. And you can see a corresponding decrease in our length of stay as well. Up at the top, the emergency department visits, and at the bottom left, the urgent care visits, you can see that those have slightly inched up. Emergency is close to pre-COVID volumes. You can see compared to the lighter bar at the left compared to the darker bar at the right. Our urgent care is still pretty low on volume, but you can see that there's a nice recovery beginning in the last quarter. Our primary care and specialty care visits remain at about 20 to 25% telehealth. The striped part of those bars represent either the telephone or the video visits. Our primary care is about 7% below budget this month, and you can see that specialty has returned and is about 14% above.
Is there still, on the telehealth piece, we don't get a facilities fee on some of those reimbursements?
So there were some favorable rulings that allowed us to bill for telehealth and even some telephonic visits in some cases. Those emergency payments have been extended, but we do expect those to end soon. And that's, so if you recall, there's a high, under a normal payment structure, video visit is reimbursed at about half of a normal visit, face-to-face. During the pandemic, the payment structures were changed for Medicare that allowed us to bill full payment for those. And that is under an emergency period. So I would expect those are going to become a little bit lower, even though we've got some really good adherence rates to those appointments. There's not as large of a no-show rate for these telephonic and video. So they are advantageous in some places.
Oh, yeah.
But we would not budget for that extra revenue for next year.
And I think the legislature passed a bill that, I may be wrong, and Zim, probably wrong, that had to do with Medicaid and enhancing the number of services that could be reimbursed through state Medicaid through telehealth. So kind of expanding the use of that. Hopefully we can tap into that.
So we're conservative when we budget. So if our plans have truly adopted that, then we will budget for it. But if it's a question or implementation date question, we may not budget for the full pickup for that.
Yes, sir.
Do y'all think that telehealth is impacting the urgent care decrease? I don't know how you'd figure it out, but
I
it's just.
have asked the question,
Telehealth.
Telehealth.
Is affecting urgent care numbers.
anecdotally, when I ask operations about, why they feel like urgent care volumes are remaining low, it's still, you're coming into the medical center for urgent care. And I think they're, again, this is anecdotal, but I think it's a patient preference not to have to come in to the hospital for a non-emergent visit.
Okay.
Does that make sense?
My second comment and question was, can you have a telehealth encounter without being seen first by a provider?
You mean a new patient visit
Yeah,
by telephone?
could a new patient
Yes, you
visit be by
can.
telehealth?
I've had a new patient visit through
Okay,
telehealth.
so we can be billing for that, correct?
Yes.
Okay.
Yes, definitely.
For now. I think it was extended, and from what I'm reading in JAMA, I think it's gonna be extended even longer, because it's a real benefit to the rural health people.
Right.
I think the feds will extend it even further.
Yeah, and I hope that telehealth helps us on the psychiatric side. That's one thing I'd really like to see is the impact of that, just.
It has, although I haven't seen the more recent. Yes, sir, it has improved a lot of the original no-show rates. Transportation is a big issue with a lot of our patients. So those who do have camera access, phones, it's helped with that.
Great. That is the most delightful earring I have ever seen on.
Your mask.
Yeah, we can get you a pair.
All right. So
We-
that's,
we-
oh, I'm sorry.
Urgent care sites, are there others other than here?
No.
No, sir, just here. And there have been discussions about should you have, and I think that's that's a big discussion for this board and for our strategy. Do you want to look at an urgent care division in our Arlington facility, or do we want to look at that? And that would certainly be a change for us, not suggesting good or bad, but there is a lot of issue with that. Now, we have seen and we've talked with our emergency department leadership as to whether they would want that, and I think they've got a lot of advocacy for doing just that. But as of yet, no, but it is a very open discussion.
I ask that because my health plan sent out a notice that they're going to start emphasizing and rejecting going to ER. They're pushing urgent care. And I was just wondering how that would impact us if we looked at that.
Yes, sir.
Reverend Emerson, as we talk about that and impacts to patients, another great alternative to more like another urgent care site is extended primary care hours. And we have started to implement that in some locations.
And how's the outreach going on that? Because you can't extend the hours without having outreach to patients.
So I would have to have someone from operations come back and talk to you about that. But if you brand it as urgent care, the patient impact, it could be a higher copay. It's licensed a little bit differently. We have the current primary care sites. And so you can either open up more urgent cares, or you can start to expand your primary care hours a little bit and use
I
the
have another
overhead
question.
you already have.
Do we charge a copay for telehealth?
I do not believe that there is. It will also depend on the type of visit. So I need to do my research and see what's happening now, and then see what is going to happen after the emergency period ends. So can I bring that back to you?
I just wondered that.
Interesting. That would be almost an incentive to use telehealth if we waive the. I'm not suggesting that now, I'm just throwing an idea.
That's the finance committee chair.
Daphne told me to say that. That's an interesting idea, though.
curious.
some sort of.
I think also we need to, especially if we're looking at what urgent care and your anecdotal kind of analysis of it, I think also what we need to look at is what are the barriers, again, to patients coming in. So I've heard, parking fees. I was here on Saturday. Parking was free. I think we don't do a great job in letting the community know that and that they can utilize those services. My sister came in for urgent care. We're in and out pretty quickly because there was nobody here. And that was like a Saturday morning, so, which is interesting to me.
I kind of wonder if telehealth is helping patients get to their primary care provider easier, and that is eliminating some of them going to that urgent care center. That might be a reason, because if you asked to have a problem and you can do telehealth and it's taken care of, folks are willing to do that than go to that urgent care center.
Yeah, that was what I was questioning.
Yeah, so I'm thinking that our primary care doctors might be a little bit more responsive with that telehealth.
Really on this page, this is showing our surgical volumes. You can see that we are almost to budget on the inpatient and outpatient surgeries. Those volumes have not only been above budget, but they're actually returning to pre-COVID volumes as well. For mental health, we were talking about, we've spent some time with the telehealth volume. This slide actually shows this at the top left. The clinic visits are a little bit more heavily weighted in psych, more towards telehealth. We're at about 40% telehealth for psych. My understanding is a lot of times there's a lot of group therapy, and that can be done more effectively with telehealth than with gathering in a small room under the current conditions. So, and really our psych, if you look at our patient days and even the emergency clinic, those have not really been impacted with low volumes for different reasons, but we've been very busy in the mental health area. On our financial metrics, days cash on hand at the top left, it's kind of got the normal curve again. We receive a lot of our monies in January, February, March from property tax payments. I will remind you the shaded top part of that is representative of the COVID relief funds. That is about 85 million or 48 days cash on hand. That is still on our balance sheet. We are still evaluating, and under the current allowance, we are expecting to recognize at least half of those monies this year, but there will be more to come on that, especially as I close out fiscal year 21. I'll bring back some information as we get it. So that is sitting on there, and if you have any other questions about the CARES Act monies, I'll be happy to bring that back and incorporate it. Someone asked about that this morning. I am happy to report the FTEs per adjusted patient day as our outpatient volumes have picked up. We've actually barely become favorable for this year compared to the budget, and we are better than last year. If you remember, this is a year-to-date number, and we have been over FTE per adjusted patient day. So this has started to fall back in line. Our connection enrollment has leveled off over the last quarter. We continue to do sign-up efforts, but we had the little drop-off that was expected for the re-enrollment in March that we had extended throughout the pandemic.
So as I'm looking at this particular trend over the years, one of the things that I'm concerned about is that connection enrollment office closes at 4:30. And so that, once I've started digging in, looking at the hours from there, our patients, that is a really hard opportunity to get to once that office closes at 4:30. Also, we need to be able to have additional timeframes as we're looking for our working class individuals who can't make it to that enrollment office to drop off their documents. So as I was looking through the trends here, if we know that re-enrollment happens, let's look at extending those hours to 8 or 9 o'clock at night to make sure that people are coming through with proper documents and paperwork as they're going through.
So we do not require in-person appointments anymore, so that will help. But I will visit with Michelle.
We might want to check with your frontline staff on that.
Okay.
Yeah.
Do we have any weekend coverage? Is it open on weekend at all? Eligibility?
Not the main office, but I will, I will bring that back
Yeah.
and see what we actually feel like is happening, and talk about the maybe shifting of hours as well.
Yeah, I mean, even at, you can do like a Wednesday or like a couple of days extended, and then do a great outreach campaign from there.
Yes.
Because that time frames are just so hard for individuals to get through, and coming in and doing the application. Some people, because it is sensitive information, even with, doing everything online, people still like to come in and have their copies taken instead of having their, social security, driver's license, and everything sent through electronic. We have to look at the population that's serving through. Even if it's not a required in-person, there's still a lot of individuals that are telling patients to come in and bring their documents.
Okay.
And so that message is getting mixed in the community.
Thank you. So the results for the month, again, these monthly statements are trending very much in the same pattern month after month. From the revenue standpoint, we do continue to have favorable collections. A lot of pickup in the Medicare uncompensated care payments that we have been receiving this year. We've also got a bump in some of the URIP payments. You guys are voting usually annually on the URIP program, and that provides a benefit to JPS as well. We've had favorable payer mix. We did budget to have an increase in our unfunded care. Last year, we anticipated that, and it hasn't really come through. So that's a variance to budget.
It's amazing how just a little variance in payer mix, how much that impacts
Yes,
the revenue.
it does.
Wow.
And we've had the increase in CMI throughout the year. That's a very large pickup. We've had favorable programs that continued into this fiscal year in paying for some of our inpatient COVID patients, as well as a bump in those Medicare payments as well. So that has more than offset some of the volume decline that we've seen during 21. Our operating expenses are pretty much tracking on budget. We did have some salaries are slightly over again. You saw some of the pickup in our outpatient areas. And then in the other operating expenses, we are continuing to look at repairs and preparation for Joint Commission throughout this year. So there were some large payments there. Year to date, we are about 50% ahead of our budget plan. Again, most of that is in the rev cycle portion of this. None of our unbudgeted amounts have changed, so I'm not going to cover these two slides unless there's any questions. And as you move on to There are. We want to keep you informed of those items. And to Steve's point earlier in the conversation, no matter how well we try to anticipate what's going to happen in Budget 22, we still are in the very preliminary stages of planning on some really large projects and goals. So we will keep you posted as those items change in 21 and likely 22 as well. Encounters were slightly under budget, but they remained about the same as last month as far as build encounters. And then our net operating expense per encounter is actually favorable by about 6% year to date. And Acclaim had a favorable month to budget as well. They are seeing some increases in their charges, and that translates into higher collections as well. And they have been able to come under budget this month and some of their operating expenses as well with open positions. The last item down there, the other operating expenses, although that's favorable to date, a lot of that has to do with recruitment and CME, so that's one line item that may catch up by the end of the year. So from a consolidated or a combined basis, I always like to point out this slide at the very right column, the total year to date. We are about $56 million ahead of budget. Again, a lot of that on the top side for both operating companies in the hospital and Acclaim. But more importantly, again, these are dollars that we can use as we begin some of these bond projects that will help lower some of our required debt and our debt payments in the future. So if there's any other questions, I'll be happy to answer them.
Any questions for Sharon on her presentation? Entertain a motion to accept her report.
Move approval to accept the report.
Motion by Mr. Bose. Do I hear a second? Second by Reverend Emerson. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you. Thank you, Sharon. Let's move to item B. We're going to pick up the pace now, right?
We are,
Okay.
and if I can explain all three of these policies, and maybe we can vote on them all at once.
Oh, that's right. Our new general counsel says we can do that now.
That's right. So I will tell you, as you guys realize, we are busy updating all of our policies, but on the first two, we spent a significant amount of time making sure that our procedures were in line with what is expected. There's not a lot of change to the policies, though. LDF 1200, employee travel and business-related expenses, we just made sure to expand beyond employees. It could be other relationships, it could be board members, it could be a recruit that we have for an interview. LDF 6600, signing authority. There, again, we really expanded it to make sure that it covered all JPS affiliates on the policy level. Before, it was really just focused on the hospital, although it did apply to Acclaim in the foundation. And then LDF 6700 is managing recalls and alerts. On the policy, we just simply stated kind of the actual regulation that we would comply with. But if there's any questions, I'll be happy to cover those in detail.
Questions for Sharon? Okay, so we'll entertain a motion on items 6, B, C, and D together. Do I hear such a motion?
Move approval.
Motion by Mr. Bose, second by Ms. Sarazola. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Sharon. And we're gonna withdraw item E, correct? It's not quite ready for prime time.
Correct.
Okay. Now we're gonna move on to Rory. Where's Rory? It's a good Irish name, Rory McCready.
Got caught off guard there with that quick acceleration.
Perfect response.
I was a little concerned too. Now they're all coming in. I feel much better.
It's like, were you fixing to stand in for me? Oh, that could have been trouble.
Thank you, Rory. Item F, please.
Usually I get to bring you guys a lot of high expense contracts for RevCycle. Today we get to bring you hopefully a revenue opportunity. We have a new managed care contract brought to you by American Health Plan of Texas. We're seeing some picked up or new activity in managed care contracting, specifically in Medicare, as well as the exchange plans, which would be kind of the Obamacare plan. So we're seeing a lot of increases. This one happens to be coming into Tarrant County. So it's an opportunity for us to kind of get ahead of some of the other hospitals and contract. A lot of times we kind of get locked out of those situations because we're a little late to the game. So we're actually ahead of this one. So
Happy to see this. Any questions for Rory? No?
all right, thank you.
Hold on. You gotta be there for the vote, because, So we'll entertain a motion on, what item is that? Item F.
Move to approve.
Motion by Mr. Zimmerman, second by by Reverend Emerson. All in favor of the motion, please say aye.
Aye.
Opposed, motion passes.
Thank you.
Thank you, Rory.
Appreciate it.
Doug, item G.
All right. Thank you very much. This is a contract for consideration between the district and Jubilant Radio Pharma. It's for $485,000 annually for a possible 5-year term, total of about $2.4 million. What this contract does is provide the hospital with radiopharmaceuticals for our nuclear medicine testing. And we went out to RFP for this contract, and Jubilant was the winner based on price and just overall service. This will allow us, over the total contract term, to save approximately $675,000 over those 5 years. And it does come with a 60-day out clause as well, too. So,
Like everything about that. Any questions for Doug? Okay, entertain a motion.
So moved.
Motion by Reverend Emerson,
Second.
second by Mr. Bose. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, Doug.
Thank you.
Dr. Elliott,
Good morning.
good morning. Item H.
All right, item H. Thank you, Board. We are here seeking approval of the agreement between Baylor University Medical Center and Tarrant County Hospital District to support our general and trauma surgery programs that we run here. It's been a long-standing collaboration with their program as an integrated program here with us, and we are seeking $1.198 million annually over times 5 years, which would be $6.3 million over a 5-year contract period.
Great. Any questions for?
1.198 annually, and 5-year contract period will be 6.36.
Great. Any questions for Dr. Elliott? We've done this for years, right? We've had this one
Yes,
for a
we
long
have.
time.
Yes, and it's critical to our level 1 and what we provide.
By 1 year? Predates, wow, really?
Yep.
Awesome.
That's great.
Okay, no question, I'll entertain a motion on item H.
Move approval.
Second.
Motion by Mr. Bose, second by Mr. Zimmerman. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Tricia.
Thank you.
Ms. Dent. Welcome. Item I.
Good morning.
Good morning.
This first one that I'm presenting is a consideration for approval of purchase agreement between Johnson & Johnson and us. This is the fourth of the 4 vendors that are originally presented. It's all in our budgeted for 2021 with a total cost of $1.4 million. It is actually saving us $117,489 per vendor.
Great.
Okay.
Any questions for Dinah?
Move approval.
Motion by Mr. Bose. Second by Reverend Emerson. All in favor of the motion, please say aye.
Aye.
Opposed? Motion Motion passes. We're pulling item J, as I
Yes.
understand it, not quite ready, and then we're gonna move to item K.
All right. This is for consideration of approval of costs associated with Medtronics. That is our vendor for our pacemaker and our AICDs. It's $2 million annually, and it is approved in the FY '21 operational budget. This is a tiered discount and is more favorable than our Vizient purchasing agreement.
All right. Any questions for Ms. Dent?
All right, move approval.
Motion by Mr. Bose.
Second.
Second by Mr. Zimmerman. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you so
Thank you.
much. Have a great day. Mr. Lane,
Good morning, everyone.
good morning to you.
I think this is the least expensive contract I've brought to date. So I am here today to talk about Camdex. They are our anti-ligature sensor provider for the doors in behavioral health. I'm asking for a exemption from bidding and approval of the preventive maintenance contract. They are sole source. They do not allow parts to go to anyone else, and they provide their own service. It is $82,672 annually, which is budgeted for this year, $255,000 and change for 3 years. And there are 3% increases, and we have the right to terminate after the first year.
Okay. Any questions for Mr. Lane?
When we get to a point, I think it'd be good to have board members go over to Trinity Springs and look at all the ligature risk that's put into place. It is significant. Doors and handles and windows and the way doors open, and one can complain about the cost, one can't complain about the saving of lives, and it's pretty amazingly significant.
That's cool. Okay. This motion needs to be two-part. One is exemption to bid, and then the actual contract itself. Entertain such a motion, two-part motion.
Move approval to the exception to the bid and to approve the preventive maintenance agreement.
Heard the motion by Mr. Bose. Did I hear second? Second by Reverend Emerson. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Hook 'em horns. Item M, Mr. Mendenhall.
Good morning, everybody, and thank you, Mr. Chairman, for not skipping over my items, which you usually do very well, every finance committee. I bring to you I bring to you today for your consideration, again, this is a two-part piece. One is the exemption to bid, as well as the support agreement. This is with Kronos. Kronos is what runs all of our payroll systems and all of our time clocks here at JPS. This is a 12-month agreement because this next fiscal year, we're going to be going out to the entire workplace, if you will, looking at human capital management as a whole to be able to see if there's ways that we can do better payroll, we can do better employee management, we can do better HR management, and so on and so forth. So as opposed to bringing a multi-year agreement to the board to approve for support, this is 1 year to tie us over until we can get into a new contract kind of session and season for us for all of the things that we do to keep track of our employees and doing payroll at JPS.
Okay. Any questions for David? All right, this is also a two-part motion. I'll entertain such.
All right, move approval of the exception to bid and to the amendment to the Kronos.
Thank you, Dorothy. We have a motion by Mr. Bose. Second by? Second by Dr. Weber. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, David. All right, we have no items for close. Is that right, Counselor? Yes, sir. Yes, sir.
Kind of a general question, maybe to Sharon. When we submit for RFQs or RFPs for large contracts, okay, and as I'm hearing today and other times, the contract comes back and it says, well, 5-year period, we have this amount of savings over 5 years. When we submit requests for contracts, are we asking for that in the contract, or are they making those offers that 5-year contract or 5-year term? Or is that what they're offering and which makes it more attractive to select that vendor?
I'm gonna give it a whirl, and then I think Daphne will have some to add to it as well. As we start to centralize the RFP process, we want the RFP and the contract terms, or our expectation of contract terms to be laid out in there. So I think best practice is what you were suggesting. You know, if we expect a 5-year contract, we should have a 5-year contract in the RFP or the RFQ. So I think we will get better RFPs as we start to centralize the issuance of the RFPs and RFQs, which is what we're working on with legal right now.
Yeah, so she did a good job of answering that. We try to scope out what our needs are, and that could include anticipating what the term is. So we'll try to start with a contract template that gives us everything that we need as we evaluate those vendors, you know, based on what they are able to offer. You know, some of that does get negotiated, but typically we're trying to align our RFP scope, contract terms with what we've initially requested in the bid through the solicitation process.
The reason I ask that then is because we have some requests of companies to comply with some of our policies. So what's our check and balances to make sure they stay in compliance during that 5-year period? They might comply at the start, but may not in the home stretch, you know. So do we do any check and balances in that process to just ensure that they stay in compliance?
Yeah, so we do have a process in particular for professional services that there's an annual evaluation of the vendor in the contract. I don't know, you know, what level of specificity it includes in terms of, you know, specific things like if we expected diversity, do we go back and check that? But that is something that we can check on. But we do have an annual evaluation process for professional services in our patient care areas.
I would just ask that it would be something we put on the table to look at in our contract, other than professional services, that we look at that to do some check and balances.
Performance, compliance, that kind of.
Yeah, and I do think when the office, when the new compliance officer gets here and we begin to look at that and figure out the role that compliance and auditing plays in the process of a contract awarded, I think those are very important. And Pastor, to the other comment that you had, which is sort of indirect, even though we have a 5-year contract, I'll go back to Leslie's comment, we always, and Daphne's good about this, we always put out clauses in. So should that company change, should they make significant differences, we are not locked into 5 years. Now, we'll receive those savings over 5 years, but in a 2-year period of time, if we find out that there is just cause or we want to change that contract, they have out clauses in them. So it's a 5-year period, but it's a semantics to say it's a 5-year contract because you can get out within 90 days. Thank you.
Yeah, I'm going to sit down and talk to you on the side.
Good, yeah.
All right. There being no, any other questions, any thoughts? Being no other questions, we're adjourned. Thank you all.
That was
Good afternoon, everybody. It's great to see you all here live and in person and around a board table for the first in-person governance meeting in well over a year. It is 12:06, and I will call this meeting to order. First up are there any citizens wishing to address the committee either in person or WebEx or whatever? None? So, cool. I will move now for approval of the April 22nd minutes. Those were included in your portal. If anybody has any questions or changes, otherwise a motion to approve.
Move to approve.
Second. I've got a motion to approve and a second. All in favor say aye. Aye. Any opposed? All right, the minutes are approved. Well, like I said, welcome to the first, golly, it seems really loud. Is it loud or is it just me?
It's just because you're here.
Wow, I'm just not used to that. Anyway, I want to happily announce that we have found a new senior vice president for, what is it, risk management?
Chief Compliance Officer.
Yeah, Chief Compliance Officer. I can't keep up with all of the acronyms and titles and names and changes, so, but Colin Warenka will be joining us in August, middle August?
Yes.
Middle of August. Colin comes, he is the Chief Compliance and Privacy Officer at Dayton Children's Hospital currently. He has a master's degree in public administration from Walden University, his Bachelor of Arts in Sociology from The Ohio State University.
That's why I voted against
Oh, is it? When your alma maters and opponents come into play, it's a scary time, but we had the opportunity and blessed with the opportunity to interview. We had three candidates, three very qualified candidates, and interviewing all three was a real treat for me to get to learn always more about what we do here with the governance committee, but we're really excited about what Colin has to offer. Like I said, he's the Chief Compliance Officer at Dayton Children's Hospital and was an inspector with the U.S. Department of Homeland Security. So he's got a lot of institutional knowledge that he brings with him. So we're really excited for him to get started. That's all I have as far as a committee chair report, and we will go to Ms. Arena for item 5A with the My Texas Direct Savings Breakdown. This is information that DT had requested at our April 22nd meeting. Arena.
All right. Hi, everybody. And it's nice to see everybody in person as well. I put on real shoes for the meeting, so I am ready. So as you say, this is follow-up data that DT has requested for My Texas Direct. We presented the overall savings from medical costs and indemnity at the previous meeting, but this actually gives you a little more detail on where those costs lie. And you'll see on the slide for calendar year 2018 is pre-My Texas Direct, and 2019 and 2020 are post My Texas Direct. We included the 2020 numbers as well, but it is not a full set of data. It is at 17 months. We'll have the 24 months at the end of this year, but we did want to give everybody an update on how it looks so far. We did remove the COVID claims from that column, but as you'll see, pre and post My Texas Direct, in 2018 and 2019, the number of claims were they were very close, 423 to 426. And also you'll notice that the medical costs, average costs per employee have decreased since My Texas Direct, as well as the number of staff lost days, and it coincides with the indemnity costs, because those indemnity costs come from the temporary income benefits received once the employee has lost 8 or more days from work. And so this program has provided a greater access for that primary care service that the injured employees need, faster access to that care, as well as they follow a consistent set of guidelines. So they get a release for light duty quicker, and with that consistency, you can get released to light duty quicker. But we also have JPS does a great job of accommodating those light duty staff members. And we have a workers' comp administrator, Dakisha Berniard, And she works in collaboration with Troy Overholt in occupational health as well as Chin in HR to accommodate those employees and make sure that they return to work and we can reduce those extra costs. Are there any questions? Okay, we'll move on to the outpatient comparison. We separated this one out because there is such a big difference from pre to post My Texas Direct in the number of medical bills as well as those costs associated with it. You'll see that there's a big decrease from $444,000 to $278,000 post My Texas Direct. And with seeing those treatment providers sooner, you get a decrease in medical bills and a decrease in those costs. So that's reflected here in 2019 as well as in 2020. On the next slide, we have an even further breakdown where you can see there's been savings in the treating physician, the inpatient costs, surgery costs, diagnostic and durable medical equipment, and as well as chiropractic services from pre to post My Texas Direct. So we wanted to provide you an update. We'll come back at the beginning of next year and give you an update and include the COVID data as well. So you'll see how that was reflected. But we wanted to give you an update on how it's going so far. Any questions? Welcome.
Anybody have any questions? I'm sure DT will have some questions.
Yes.
So
When you get the report again.
yeah. I know this is on the portal, and I'm sure he'll have some questions, so you might stand by for that. But we do appreciate the follow-up report as we requested. So,
Sure, no
thank you.
problem. Thank you.
All right. Michelle, for item 5B, for the compliance program reports and updates, she's got a little bit of board education about the pepper.
Yes, sir.
I learned a lot about the pepper this past week, so.
$154 unique individuals that had about 700 disclosures. So we'll start that review and vetting process at this point. I mean, June 30th, that's when it will begin. So for today, what my plan was, again, to educate the board for each meeting, we like to talk a little bit about, board education. I wasn't sure how many people have heard of the PEPR. But it stands for Program for Evaluating Payment Patterns Electronic Report. It's a mouthful, but it is a CMS report, basically. It started in 2003, and by 2010, they were including acute care hospitals. And what it looks at is all traditional fee-for-service, inpatient, Medicare, paid claims, is what I really should have up there in that first bullet. And what it does is focuses on what's called target areas that may be, in CMS's opinion, those that are most prone to abuse or improper payments. So a great example is one-day stays. And because it's an inpatient one-day stay, typically there could be an outlier. And so there's 12 fiscal quarters, so there's 3 years of data that is consistently present on this report. Again, it comes out every quarter. And what they do is there's 3,300 hospitals, acute care hospitals, and they compare each hospital to one another on a national, a MAC, what's called a MAC jurisdiction, which is Medicare Admin Contractor jurisdiction. So we have 600 of those in our facility. In our jurisdiction. So that would be, I think, Arkansas, Louisiana, I think there's Colorado in there, and Texas are all together. And then they compare us within Texas itself, so about 300 other acute care hospitals within Texas. And what they're really looking for is, do we have any hospitals that fall outside of the norm in billing patterns? And again, on these 26 areas. And so that what they have is a high and a low outlier percentage, and they consider a low outlier if you're in the bottom 20th percentile, or a high if you're in the top, or you're above the 80th percentile. And just to be clear, it doesn't obviously conclusively identify that we have a problem. It's just giving you a focus area to guide potential auditing and monitoring efforts of what potentially could be an outlier or a billing problem. So compliance's role in the PEPR. In years past, up until really about 2019, it was sort of, I could staged in quality. And so what we've done now, as of December of 19, we've established an official committee, PEPR Review Committee, and we formalized it with an approved charter. And what compliance does every quarter is we get those results, we summarize these results. It's a very lengthy report, so we summarize it and we facilitate a discussion for the committee. And then we develop an active approach to potentially explaining why we think we have these high or low outliers, if they're already on that quarterly report. And you can see the list of participants in that meeting. So it really takes a village to get to know and get all the input from all the right places to determine, do we think there's an outlier? And if we do, we assign an investigation or an audit going forward to present at the following meeting about what did we find in that potential outlier area? Was it validated? Do we need to mitigate anything? Do we need to repay anything? So those are brought forward to this committee. And then, of course, we have corrective actions and we educate one another on this as well. And we obviously mitigate the likelihood of any future outliers, right? And so in terms of compliance's role, I wrapped it up and we identify, we validate the issues if they are potential billing aberrant patterns, and we mitigate and then record. Record, all that really means is, because it's a committee, we take minutes to memorialize what we decided to do, whether or not there were outliers were validated, whether or not we had any corrective actions. And so that provides a solid audit trail in the event that we were, to ever be audited, and we'd have a good defendable position about what we decided to do with the results. So essentially, that's the PEPR and what we do in compliance to address it. Can I answer any questions? I'm sorry, sir. I don't think I had my microphone on the whole time.
You're good.
either. Oh,
The
my
question
goodness.
was, what happens after you identify a problem or a,
So we have first of all, we have a conversation. Can we logically explain what has happened? So as an example, ventilator support, obviously rose within the first quarter of, or second quarter of 2020, right, with the COVID. Is that a reasonable explanation? And so this group of individuals determines, do we need to look at this? And we assign someone at that point who is the most appropriate person to dig into these claims, to dig into the billing patterns, and bring back to the committee their results. Does that answer your question?
It does, but if you identify an outlier at a quarterly meeting, why do you wait for another quarter?
So that's a great question. We could try and do it beforehand, but it's really getting that PEPR. We have the meeting immediately after that PEPR is released, so it is a look back. It's definitely a look back to make sure that we don't have any issues going forward. So it's just a challenge in terms of timing, in terms of how the report comes out and how the meeting is structured and when the meeting occurs. So it's kind of hard to get someone on the line before the meeting because the PEPRs come out and we don't know who's the best person to research this. We don't know if there's a reasonable explanation or a logical explanation until we have that group together and we have that conversation to determine if we have an issue or not.
and
And after they identify it, they don't wait, they start working on it if it's
Right. Well,
identified.
that's-
And then they'll come back at the next quarter and report out. I think that was your question.
Yeah, it's just, there's always discussion about Medicare and what goes on and what does not go on. You almost need 20 people
Yeah.
just to look at one modifier, for God's sake.
well, the good news is imagine how difficult it is to get this committee together every 3 months.
Yeah.
Put that into the government, and we're looking back 2 years ago. So, CMS, it's a free report, but it's also compliance's roadmap as to what the next thing they're gonna be looking
Because
for.
I'd never heard of the Pepper report. It was brand new to me, just.
Awesome.
It's actually
Did
the
our job.
only acronym I understand in this whole mess.
I'll bet we can come up with some more.
Michelle, thank you for the Pepper education.
Yes, sir.
We've got now item C, 5C. We have some policies for approval. COM 8700, just for the committee's reference, is a new policy. The other ones are minor changes.
So I think I'm presenting this one, and you stole about half of my presentation by saying that it was new. So this is a new policy.
I take back everything I said.
This policy is being proposed in connection with the regulations that were put out, or that were published implementing the interoperability provisions of the Cures Act. The only substance to this policy is to really establish that we're going to comply with the law and then to set forth the definitions that go along with the particular act. So we're just asking for approval to adopt this policy.
Anyone have any questions? Comments or concerns? All right, I'll ask for a motion to approve COM 8700.
Move to approve.
Second?
All right, all in favor, say aye.
Aye.
Any opposed?
How do you think they came up with actor?
I didn't hear you, I'm sorry.
How do you think they came up with actor?
Actor?
Yeah, it's, as part of the, as used in the policy, a CMS regulated payer health, so that's almost anybody.
Oh, well,
Just about.
It's defined.
Sure.
In the act. You're right.
Yeah, for me, an actor is
this,
Hollywood.
this way, yeah.
How did we distinguish between that
Yeah.
actor and this actor? Yeah.
All right, COM 8700 is approved. And here's another acronym. The NPSG 500.
Is Dr. Stevenson?
Do not see Dr. Stevenson.
I think they're in the.
Let's go ahead and go to the, number 3, NPSG 800, handling and moving policy. I see Ms. Joy Parker here.
All right, good afternoon. So this policy is up for renewal. There are some just minor grammatical changes, but essentially this policy scope is intended to describe our guidelines for safe patient lifting, handling, and movement, so that we're in compliance with all local, federal, state guidelines and our Texas Health and Safety Code. So that is pretty much the scope of this policy, and I would ask for your approval.
Anybody have any questions, comments? The red line is included
Yes.
in the packet if you had any questions. All right, I'll ask for a motion to approve.
Move approval.
Ms. Dorothy, second. Amanda, all in favor, say aye.
Aye.
Any opposed? All right, motion passes.
Thank you.
We have had 7 different people text Dr. Stevenson, and so I'm not sure where Dr.
It wasn't that much
It's,
change,
it's,
Danny.
no, it's,
So-
it's
I just
largely
didn't want y'all to be
grammatical.
insulted that he was not
No.
here, but we're all trying to find him, so he's vibrating enough from his phone that I think he's probably busy.
Yeah, so I'll stand in for Dr. Stevenson for purposes of requesting the committee's approval. Again, this is just one that needed to be, it was going through its triennial review. I think there's non-substantive comments to the policy, and we just ask for the committee's approval to move those forward.
Okay.
Any questions or concerns? All right, I'll ask for a motion to approve.
Move to approve.
All right, there we go. Well, y'all are right on cue.
If you all would embellish that a bit and tell Dr. Stevenson's that was very difficult,
Right.
a long time, and that was an hour-and-a-half discussion.
I'll move for, we've got a motion and a second. All in favor, say aye. Aye. Any opposed? Great. Tell Dr. Stephen, thank you so much for his work. And that will be 4 cookies.
I was gonna say, Actually, it may be precedent
Yeah.
setting. It's already worked.
Dr. Stevenson, that will be 4 cookies to each member of the committee.
And 5 for me.
And 5 for Daphne. She laid on the sword. Thank you.
The only thing I think was the trouble with that is, I think his policy passed faster with him not being here than with him being here.
But we missed the jovial introductions and everything. All right, I believe now we adjourn for closed, is that correct? So it is, what is that, 12:26, we will move to closed session. However that happens,
Yeah, give them a few.
yeah. It's 1:20. We've reconvened from closed session, and with no further business before the governance committee, we stand adjourned. Thank you all.
Thank you.